patients in respiratory distress are really breathing hard. They require a flow rate of about 30 liters per minute just to maintain their normal vital load. So if you're only putting 15 liters by mass, they have to pull in that much other air source in order to match the respiratory. That's why a lot of patients pull the mask off. It's restricting the air
Restricting what they need.
So if you put a high flow nasal cannula on at 15 plus liters, plus that non-rebreather mask on at 15 liters, you're matching that 30 liters per minute, and it'll be a lot more comfortable giving you enough airflow to feel like they're not suffocating.
So for the full range, we would have to bring both of our oxygen tanks in. One would be cannula, one would be either a vent or a BTM or whatever.
But for us, if we only have one oxygen source, we'll have that high flow nasal cannula going and just BBM later.
Okay.
And that's for just respiratory distress, right? I mean, your
Yeah,
cardiac
or apnea
arrest.
patients.
Okay.
Cardiac arrest patients will use the nasal cannula as well.
All right, because we've got that protocol. It's OPA and non-rebreather.
Yep. And the advantage of in a code situation, if you have that high flow nasal cannula going, every time that chest recoils during compressions, it's drawing oxygen. So you get that
And that's
massive
the theory
oxygen.
that we were, that's our theory of that. But I do like that nasal, the OPA or the NPA instead of the OPA with that. So, no, I like it. See what happens.
Yeah.
I'll work next day. I'm sure we'll have one. All right, I'm ready.
What's that?
No, it's just
a normal.
You just put high flow oxygen into
Yeah,
it.
he's going beyond what.
So they just feel like there's a freight train going through their
Yeah, it's not bothering them.
nose. Yeah.
Even a lot of our older ladies with CHF and stuff, they really tolerate that 15 liters by cannula very well. I mean, it makes them more comfortable because they feel like they're getting airflow going. So it has a sedative effect for the patient a little bit.
Are you guys ALS?
Yeah.
We've got a mix of agencies in here today.
Yeah. Our fire department, everybody's trained at the basic level, either they're first responder or they're EMRs now, or EMT base. Ready? Alright, touching down as far as you can see, grab that laryngoscope. Just verify quickly that that hypopharynx is clear of any fluid and secretions. As soon as that airway is clear, you're going to pull both out, send it off to the side, and immediately go to oxygenation. So your partner at the airway bag will be handing you nasal cannula, oral airway, nasal airways, high flow nasal cannula. There we go. And then we'll get that patient's head elevated on your foot and start BBM patients. Now the positioning guy will be grabbing the wedge. As soon as it's ready, he'll just tell you we're ready to position the patient, but everybody waits until you say go ahead and position. So nice, smooth, slow movements. Make sure nothing gets dislodged. You go back to bagging the patient. The person at the airway kit will be prepping your advanced airway at that point.
All right, ready?
That's actually to the
This is to get. Oh, I thought you did it down here.
Well, you can use it.
But after.
Feel that resistance, that quick scissors technique. One comes out, the other goes in.
What size fits in the actual eye gel on the side?
I believe those are 12.
And then we hook up all the rest of our stuff. So I got a question for you.
Yes.
So because we have not transitioned to the LGLs yet, we are in process.
Kings,
When we talk a king and we talk about this motion of okay, we know we've got suction, we got to resuction, and that pull out and go past.
Yep.
Are you able to accomplish that?
you can, but you have to deflate the cups.
Okay.
Now, with the King LTSD, I do not recommend removing the device for any purpose because there is a small percentage of patients that can develop lingual edema rapidly where the tongue just swells up and then you're not going to have any airway at all.
Okay, that's what we were
So I
talking
never
about.
remove that, but if you deflate the cups, you can sink this catheter around the side of the mouth, in between the two, suction out, pull it out, reinflate the
All right,
cups.
that's what we're talking. If you recommend deflating, then do it, or
I
because I would
recommend
assume you'd
deflating
just
it
perforate
first.
the cuff if you didn't.
Right.
Yeah. Okay.
So,
Awesome.
do paramedics use the eye gel then?
We use this as a secondary device.
Okay.
So we have both Kings and iGels. Our fire department only